So, what is pneumonia? Pneumonia is an infection in the respiratory system that attacks the lungs. It causes the alveoli to fill with fluid or pus and become inflated, making it difficult to breathe. This causes less oxygen to reach the blood and to the body cells. And so, with the body cells not working properly, the infection could spread in the body and cause death. Pneumonia can be caused through bacterial and fungal infections or even viruses. There are over 30 causes that can lead to pneumonia. Viral and bacterial pneumonia is contagious and can spread from person to person through a simple sneeze, cough, or inhalation of the airborne disease. Although you can be infected by fungal pneumonia in the environment, it does not spread from person to person. These are some of the common symptoms among the different types of pneumonia: chest pain, chills, coughing greenish/yellow mucus, fatigue, confusion, sweating, vomiting and nausea, and shortness of breath. In the US alone, 3 million cases of pneumonia are reported per year. Among the 3 million patients who suffer from pneumonia each year, 60,000 die. About 34% of pneumonia cases that occur each year occur in adults above the age of 65. About 4 out of 100 children have the chance of developing pneumonia. As mentioned before, pneumonia can spread through many different ways, like bacteria, viruses, and even in air, food, and water. But some people have higher chances of developing pneumonia due to the medical conditions they're in. For example, if you have diabetes, emphysema, HIV or AIDS, or sickle cell disease, you are more likely to develop pneumonia than someone who does not have any of these problems. There are also other non-medical conditional factors that can increase the chance of getting pneumonia. For example, adults above the age of 65, infants or children that have very weak or immature immune systems, people who live in areas with high level of pollution, farm workers who are exposed to agricultural chemicals, people who work in industrial settings, people who work near animals, and finally, people who smoke and or drink too much alcohol. But in the end, anyone can get affected. It is important to understand the cause in each case of pneumonia, as each case has a specific treatment. Bacterial pneumonia can be treated by prescribing antibiotics to an affected individual. The antibiotics will kill off any of the bacterial cells in the body in order to get rid of the pneumonia and the symptoms in the body. With antibiotics, however, it is important to complete the prescription period to ensure that all bacterial cells are killed off and no survivors remain, so that the bacterial cells will not just develop antibiotic resistance. Other ways to treat bacterial pneumonia is to take oxygen intravenous fluid and breathing treatments to ease off and get rid of the symptoms. Viral pneumonia can be treated by taking an antiviral medication such as Tamiflu. The antiviral medicine kills off any cells infected by the virus and prevent the virus from spreading even more uh, by exterminating any viruses in the body. Other ways to treat viral pneumonia is by drinking lots of fluids, eating healthy, and resting, taking medication for sickness, and treating any breathing difficulties you may have. Fungal pneumonia can be treated by taking antifungal drugs that will fight off the fungal infection in the respiratory system. These drugs can be taken orally or intravenously. Although it is not possible to completely prevent pneumonia, there are many steps you can take to help reduce the chance of developing pneumonia. These are just a few things you can do. Get vaccinated. By getting the flu shot every year, you can reduce your chances of getting viral pneumonia. Wash your hands. As I mentioned before, pneumonia can be anywhere, in food, water, and in the air. By washing your hands, you are preventing the germs on your hand from entering your respiratory system. Don't smoke or drink too much. Smoking and excess drinking will weaken your immune system and make you more vulnerable to pneumonia. Eat healthy. Rest. Resting regenerates your body so that your body can easily fight off any foreign substances from entering your body.